And welcome to our second part of our Pillars of Fitness series. My name is Craig Cole and I'm going to be your presenter for today. Today we're going to be talking about our cardiorespiratory health. We're going to be discussing the overall anatomy of our heart, our lungs, and our vascular system. And we're going to be talking about how when we get our body engaged in exercise, what essentially happens to our heart and our lungs. What happens to those various components within them that allow them to function to their capacity. We're then going to be discussing how exercise has long-term adaptational effects for our cardiorespiratory health, and we're going to be discussing briefly what we can do to achieve a cardiorespiratory fitness program and some ideas that go behind that. A cardiorespiratory system is comprised of various systems within the body, such as the heart, the lungs, and our vascular system. All these systems work to allow the body to perform sustained, large muscle movements that utilize oxygen while expelling carbon dioxide from our working muscles. Cardiorespiratory capacity is determined by the fitness of our heart, our pulmonary, and vascular systems. The cardiorespiratory capacities can be increased by developing greater cardiac output, and this results from a larger stroke volume. And our stroke volume is the amount of blood that's ejected from our left ventricle for each beat. We can also improve our vascular adaptations, and this means that we can increase our blood flow to our working muscles. We can improve our soft tissue adaptations, and this means that we can teach our tissues to utilize oxygen more efficiently. We can also have greater efficiency of gas exchange at our alveolar sites, giving us better support for oxygen demand. For our next few slides, we're going to be talking about our cardiorespiratory anatomy. We're going to start off by talking about our vascular system. Our vascular system is a closed conduction of tubing that allows for blood circulation that originates from our heart. It's important to know that there's different types of tubing that perform various functions. Our arteries, arterioles, capillaries, venules, and veins all perform various functions. Our arteries are involved in two different types of circulation in our body. We have our systemic circulation, which carries oxygenated blood to our tissues, or pulmonary circulation, which carries oxygenated blood back to the heart. Our arterioles merge with capillaries to supply oxygenated blood. Our capillaries are sites of gas, nutrient, and waste exchange within all of our cells. Our venules merge with our capillaries to return deoxygenated blood. And then finally, our veins return deoxygenated blood back to the right side of the heart. In our little diagram at the bottom of the slide, it depicts the various layouts from our arteries to our veins. Our capillaries are sites of merging for our arterioles and venules. And at our capillaries, it allows for oxygenated blood to get supplied to our tissue and deoxygenated blood that carries carbon dioxide with it to be transferred to our venules so that's relayed back up to the heart. So in a nutshell, it's basically to think that the arteries take blood away from the heart, and then in return, our veins return blood back to the heart. As we learned about in the previous slide regarding our vascular system anatomy, we now know that the arteries and veins help circulate blood throughout the body in a closed system fashion. But now we're going to talk a little bit more in depth about our pulmonary and systemic circulation. Our pulmonary circulation cycles deoxygenated blood from the heart to the lungs, where it is reoxygenated and returned back to the heart. Our systemic circulation cycles blood from the left side of the heart to the various tissues in our body and then back to the heart. So both of these types of circulation allow for our tissues to remain oxygenated while getting rid of the metabolic waste product of carbon dioxide and any other waste product so that it can be shunted away from the tissue. So what are the benefits of our vascular system and how does it truly help us? Well, our vascular system helps transport oxygenated blood from the heart to the body and deoxygenated blood back to the heart from the body. It allows for nutrient distribution to our tissues. It helps remove metabolic waste products such as CO2, lactate, urea. It allows for our pH in our body to be regulated. It helps transmit hormones and enzymes throughout our body, and helps us maintain fluid balance so we don't become dehydrated. Now that we're done talking about vascular anatomy, we're going to be talking about the anatomy of the heart. We're going to be discussing its overall anatomy and also blood circulation. It's important to note the heart has 4 different chambers that help circulate blood throughout the body. We have our left and right atrium and left and right ventricle. When it comes to blood flow throughout the heart, the oxygenated blood from our body is pumped from the right atrium to the right ventricle. This blood is then pumped through the pulmonary arteries to the lungs so that it can be oxygenated. Our lungs then return this blood through the pulmonary vein. This blood is then pumped from the left atrium of the heart to the left ventricle so it can be distributed to the rest of the body. Our heart has a natural pacemaker called the sinoatrial node, and this can be located almost in the center of the heart. And on our diagram, I have a circle that kind of depicts exactly where it is located at in the heart. The SA node that initiates the cardiac muscle contraction regulates each beat. This is called an intrinsic regulatory system control. In order for the heart to prepare for exercise and stress, though, we have something called an extrinsic regulatory control that comes from the nervous system and endocrine systems. Our extrinsic control factor helps us regulate our heart rate, the force of contraction of beat, blood pressure and blood vessel diameter, as well as a respiratory control center that regulates rate of breathing and volume of breath taken in. Our sympathetic nervous system stimulates increased response from the body, while our parasympathetic nervous system helps to return cardiac function back to its resting level. We're going to finish the discussion of the cardiorespiratory anatomy by talking about our lungs. So if we think about our heart as a muscular pump to help push blood throughout our body, we need to think of the lungs and their associated structures as a respiratory pump. The lungs are part of the pulmonary system that allows for cellular function while at rest and with activity. They help remove carbon dioxide, keep our tissues oxygenated, and allow for the production of sustainable energy in something called adenosine triphosphate, or ATP for short. Inside our lungs, there are terminal ends of bronchioles that branch into alveoli, which are conducting zones for carbon dioxide and oxygen. The pulmonary system regulates breathing and helps filter out inspired contaminants. So within our diagram here, I'm going to mark the end stage areas of our bronchioles. And at the end stages of these bronchial trees, if you will, is where our alveoli are located. And the picture that is right next to it here, alveoli basically look like a bunch of little balloons that are attached to a string. And all these alveoli are the areas of gas exchange for carbon dioxide and oxygen. In our lungs, there's hundreds of millions, over 300 million alveoli that help with our gas exchange. And it's very important that we maintain a good aerobic capacity because it helps keep the gas exchange efficiency up to its peak efficiency. We're going to be moving on from talking about the anatomy of the cardiorespiratory system. We're now going to be talking about how the heart, lungs, and vascular system respond to exercise. Our heart rate increases based upon the amount of muscle used, the intensity of movement, and the duration of the movement. Our oxygen uptake and heart rate all increase as the work rate increases. It is usually noted that our heart rate is about 220 beats in humans at max. Our resting heart rate usually varies between 60 to 100 beats per minute in a normal healthy human being. Exercise intensities of low, medium, and high elevate the heart rate until heart rate max is reached. If a workload is held constant, our heart rate will plateau after initially increasing at the start of exercise. Heart rate will increase as workload intensity increases. For resistance training, heart rate will usually increase after each of the first 4 sets. The heart rate will usually plateau but will continue to fluctuate each set as it starts and stops. The stroke volume is the amount of blood that's ejected from the left ventricle each beat. The proportion of blood ejected each beat is called the ejection fraction, which usually averages about 60% at rest. It normally increases with the rate of work. The ejection fraction is usually looked at by cardiologists in relation to heart failure in cardiac patients. Cardiac output is the volume of blood pumped by our heart per minute. The cardiac output is increased by both the heart rate and stroke volume, which it is a product of. The stroke volume will usually level off, but the cardiac output can continue to increase as heart rate increases. During resistance training, concentric actions do not generally cause increases in cardiac output. but can increase with eccentric actions. In continuation of our discussion about the cardiorespiratory system's response to exercise, we're going to be talking a little bit more about blood pressure. Our systolic blood pressure increases as the intensity of exercise increases. Exercise has more of a direct impact on our systolic blood pressure than it does our diastolic blood pressure, and we'll be talking about that a little bit more here in a moment. Upon initiating exercise or more intense movements, though, our sympathetic nervous system triggers vasoconstriction, forcing blood vessels to distribute oxygenated blood to our working muscles. The parasympathetic nervous system then helps open up our blood vessels through vasodilation, bringing the blood pressure back down to resting levels as the intensity of exercise or movement decreases or ceases. In aerobic exercise, as exercise intensity increases, our systolic blood pressure will continue to rise, and our diastolic blood pressure normally stays the same or slightly decreases. The reason why our diastolic blood pressure stays about the same or decreases is that the peripheral resistance through the vasodilation of the arterioles to our working muscles occurs. This reduces the amount of pressure that's needed through our arterioles. In resistance training, our blood pressure response relates to the Valsalva maneuver. The Valsalva maneuver is a method of forceful exhalation against a closed airway, almost like trying to exhale while holding your breath at the same time. This happens often when the body is placed under significant stress during a lift. But we also have where blood pressure response relates to muscles being activated, those muscles' actions, and the intensity and duration of a set. Normally during the concentric phase of a movement, the muscles contract, restricting blood flow, which elevates our blood pressure. Blood pressure decreases normally happen during rest periods when the muscles go into a period of relaxation, allowing our blood flow to return back to normal. The last discussion that we're going to have about the response to exercise is going to be in regards to oxygen consumption, or VO2. Oxygen consumption is the amount of air consumed per unit of time. We're going to be discussing both anaerobic and aerobic training for this purpose. Aerobic training increases our VO2 max as our exercise or workout increases overall intensity. Now it's important to note that our VO2 max is the maximum amount of air utilized during an exercise session. A great aerobic exercise that helps improve our VO2 max is simply walking on a treadmill or walking outside. We can change up various intensity levels that will help improve our VO2 max by changing up our movement speed, changing up the incline on our treadmill, or changing the land grade that we walk on, adding some type of external resistance such as hand weights, or in some cases a parachute like sometimes you see an athlete wear, but then also increasing our muscle usage. We can increase our muscle usage by adding an external device such as a trekking pole. And a trekking pole is going to incorporate more usage of our upper body in such our shoulders, our chest, and our back. Now some examples of anaerobic training are resistance training and then also sprint training. Now anaerobic training VO2 levels fluctuate normally due to inconsistent movement patterns, but they can still increase VO2 slightly. Resistance training slightly increases the VO2 through a couple different means. We can change the intensity level. That's either by adding more resistance or adding more repetitions or more sets. We can shorten up our rest intervals between sets or even the exercises. We can have larger muscle group activation through using compound movements. We can also change up the repetition velocity speeds that we do for every single exercise. Now with sprint training, even though it is a modality where an individual is running, one of the reasons why it does not allow for VO2 adaptations either during or post exercise is that it doesn't have enough of a duration of movement. It's too quick. So because it is too quick and too short a duration, it does not give enough time for our cardiorespiratory system to adapt. We're now going to be discussing, quite honestly, getting ready to move. We're going to be talking about aerobic exercise prescription and how we can implement a training program into our daily lives. We're going to be talking about a program called the FitVip through the American College of Sports Medicine. And FitVip stands for frequency, intensity, time, and type, but then also increasing our volume and progression of exercise. This is a great way to start out on an exercise program and then make adaptations as you become more fit. As I noted, we're going to be discussing about how to develop some type of exercise program with aerobic training as a primary focus. I noted that we're going to be following a program called the FitVip protocol. And this is again the frequency, intensity, time and type, volume, and progression. And this is based upon clinical trials through controlled studies through the American College of Sports Medicine. The FitVip protocol is generally guidelines for the majority of apparently healthy adults, but honestly, not all individuals are going to have the same type of response due to physiological variances. The protocols can be modified up to the participant though. Any type of training should have a positive impact on our VO2 max, which is what the primary goal of aerobic training is. VO2 max is known as the functional capacity of the heart. It's the maximum amount of oxygen consumed by the body during an exercise session. Aerobic training has 3 defined objectives for exercise. Be maintained at a constant intensity, such as walking or jogging. Promote energy expenditure related to a skill, such as skiing. Required skill and intensity are variable, such as sports and intervals. So basketball is a great example. Players are running up and down the court, taking a shot, getting back on defense. They're going through a plethora of different movements, all within one time frame that requires skill. Most of the recommendations to the American College of Sports Medicine are consistent whether you're a healthy young adult or a more mature adult. The American College of Sports Medicine has a pretty well-defined guideline for aerobic training for individuals. We're going to be looking at the FitVip protocol for apparently healthy adults. Our frequency traditionally is where we want to have at least 5 days a week of moderate exercise or 3 days a week or more of vigorous intensity exercise. If we can have it where you're doing a combination of both moderate and more vigorous, we want to try to have between 3 to 5 days a week. The intensity of our movement should be moderate or vigorous, which is recommended for most adults. For those that are deconditioned, normally starting out light to moderate may be more beneficial. The amount of time that we devote into our workouts should be approximately 30 to 60 minutes a day of purposeful moderate intensity exercise, or 20 to 60 minutes a day of vigorous intensity exercise, or again a combination of both, which is recommended for healthy adults. Now the time that we try to accumulate per week should roughly come out to be about 150 minutes per week of moderate intensity exercise, or 75 minutes a week of more vigorous intensity exercise. Again, when it comes to time, a trick to this is it doesn't have to be all at once. If you're doing a 30-minute session per day, you can break time up of 10 minutes in the morning, 10 minutes in the afternoon, and then 10 minutes in the evening. And that's an accumulation of time, especially if your schedule is a little erratic. The type of exercise that we do should be regular and we should be purposeful, and should also involve all of our major muscle groups. We ideally want it to be where it's continuous, without interruptions, and where it's more rhythmic in nature. Our volume of exercise should target a volume of 500 to 1,000 METs per week, and this translates out to about 1,000 calories per week. If we're focusing a lot on our walking, we want to try to increase our pedometer step count by 2,000 steps per day. Traditionally, exercising below these values can still be beneficial for individuals unable or unwilling to reach this amount of exercise, especially if you're deconditioned. If you're deconditioned, you want to start out at a pace that you feel is comfortable and work each week on trying to progress your overall exercise duration. And that's where we're going to talk about the last part of the FitVip protocol, our progression. A gradual progression of exercise is by the volume of adjusting the exercise duration, the frequency, and the intensity until the desired exercise goal is achieved. We want to try to start an approach that is start low and go slow. This way we actually have adherence to our program, and we also reduce the risk of any musculoskeletal injuries or any adverse cardiac events. I want to touch a little bit more now about our exercise intensity, and I want to kind of discuss that a little bit more in depth. So when it comes to our exercise intensity, we need to understand that we can get it through a few different means. We can get it through our target heart rate, and we can get our target heart rate through a stress test that we may have had with a cardiologist. We can also achieve it through a physician order, so it's a target heart rate that your doctor recommends for you. We can also do it on our own through what's called an age predicted method, and this is where we take our age and subtract it from 220, and then we do a percentage calculation based upon that value. So if we're looking for a moderate target heart rate, we're going to use around like 60%. And then if we want to try to achieve more of a vigorous target heart rate, we're going to be looking at 80%. So again, that calculation is going to be 220 minus your age, and you achieve that value and then multiply it by a certain percentage to achieve your target heart rate. And ideally, we want to try to get it to be where we create a range. So 60 to 70%, 75 to 85%. You can take those different percentages to create a prediction for a target heart rate. But then we can also use a rate of perceived exertion. And our rate of perceived exertion is based upon a graph, and you see it here to your right, called the Borg scale. And it starts from 6 and works its way up to 20. Ideally, we want to try to achieve a working number on that scale of 11 to 14 to achieve moderate intensity. Now, for our target heart rate, this can actually be a subjective number. Our heart rates can be increased or even suppressed. Certain substances such as caffeine, nicotine, alcohol, and certain medications can increase our heart rates. Stress can even increase our heart rates. Now, our heart rate can also be slowed down by certain medications such as beta blockers. It's important to note that not everybody will be able to achieve their target heart rate for various reasons. And that can be from a genetic standpoint, that could be from a previous surgical standpoint. There could be a variety of reasons. But this is where the RPE scale really does come into play. And again, ideally, we want to try to have where that rate of perceived exertion is between 11 and 14, depending on a person's fitness levels. Those that are a little bit more physically fit can start working on achieving RPE levels that start going into the hard or even very hard categories, working almost 95% of their exercise capacity. So the RPE scale is considered to be something that is a good field test barometer to understand what your working level is. Now, it's important to understand too that the Borg scale, every single one of those values, that if you add a 0 to it, it actually is going to earmark an approximate heart rate level. So if you're sitting and you're working at an 11 on the Borg scale, if you add a 0 to that, your heart rate should be approximately around 110. And the further up that you go onto the Borg scale level is going to also indicate an increase of your overall exercise heart rate. So again, the Borg scale is a very useful field tool to be able to use just on your own to recognize your overall exercise intensity level. Going into some of our cardiovascular adaptations with exercise, we're going to be looking at how both aerobic training as well as resistance training can have some morphological changes on our heart and our vascular system. So looking at aerobic training, we're going to notice that our cardiac output and our stroke volume have a tendency to increase. And this increase is important because it means that we're having more blood flow coming from the left ventricle each minute as well as each beat. And this helps give better blood supply to our overall body. Now we'll also notice that our heart rate at rest as well as our maximal heart rate has a tendency to decrease down. And this overall means is that our heart does not have to beat quite as often to be efficient. So the reduced number of beats is a positive sign for our overall heart health. We'll also have where our end diastolic volume has a tendency to increase. And this is due to increased amounts of blood and increased blood return to the left ventricle with exercise. We'll also notice that there's an increase in capillary beds into our developing into our trained muscle tissue. So what's going to end up happening with this is we're going to have where there's increased capillaries, which is going to aid into the ability for our muscles to go through gas exchange as well as have better enhanced nutrient delivery. We're also going to notice too that our blood pressure at rest and with submaximal and peak exercise is going to reduce down. And this overall means that there's going to be less peripheral resistance coming from our arteries going to our working tissues. Now, with resistance training, we're going to notice that our systolic and diastolic blood pressure is going to decrease. And again, this is a very important component, just like with aerobic training, in that we want to have where our overall blood pressure reduces down, because there's going to be basically, again, better peripheral openings from our arteries, allowing for blood to get to our working tissues. We'll also notice that there is going to be an increase in our left ventricular hypertrophy aspect. And this means that the muscle tissue of the left ventricle is going to have an increase due to the contractive force resulting from the left ventricle. So because resistance training incorporates heavier loads and more demand from our muscle fibers, we're going to have it where there is a stronger contraction coming from our left ventricle to pump blood throughout our working muscles, especially when they contract. Now we're also going to see enhanced oxygen utilization again, as well as enhanced capillary development. And again, this is very important when it comes to the aspect of gas exchange at our working muscle tissues, because if this exchange didn't become more efficient, our muscles would fatigue out very quickly and we just wouldn't be able to function quite as well. Now, all these changes are pretty important, especially for those that have hypertensive challenges when it comes from a blood pressure standpoint. And sometimes we can see blood pressure changes in the range of 5 to 7 points. And this can be very important because somebody who's severely hypertensive, that essentially could mean the difference between life and death for an individual. Now, usually aerobic training is usually described as the overall means of reducing blood pressure, but we can actually see reductions in blood pressure from a resistance training standpoint, especially for those that do any type of circuit training class. And the circuit training is very beneficial because circuit training incorporates very light loads at high repetitions in short amount of time. And this can be enough that can help improve the overall quality of health for our cardiovascular system. So we talked about what happens to our heart and our vascular system, but now we're also going to talk about some of the adaptations that occur with our pulmonary system. Really, there's little to no change that occurs in the physical lung capacity or the volume through aerobic training. Aerobic training usually can decrease respiratory rate at rest, though, so that reduces the amount of times we have to breathe while we're at rest. Some of the adaptations that we experience are increases in our lung ventilation, leading to greater volumes of air that are able to be exchanged. Our respiratory muscles become stronger. That means the muscles in our diaphragm and our intercostal muscles become stronger. And these are muscles that actually help expand our chest, allowing us to breathe more air with less fatigue. We have an increase again also in our capillary capacity, and our capillaries increase the number and size, which allows for more blood to be drawn in and out of our lungs. We have increases in our alveolar capacity. This allows for more efficient gas exchange at those bronchial extensions. We have an increase in our gas exchange efficiency. So for aerobic exercise, this means that we have better efficiency of our tissues to absorb oxygen, but then also release carbon dioxide. Then for our anaerobic side, or the resistance training side, we have it where there's improved gas exchange at the muscle tissue. Then last but not least, we have it where our VO2 max increases as well. And this is improved directly through aerobic training by improving all of the above capacities that we just talked about. Now remember, our VO2 max is the amount of, or the maximum amount of air that a person can breathe during an exercise session. The VO2 max is a strong component of our respiratory fitness that dictates essentially how long a person can sustain a certain aerobic exercise. In a previous slide, we had talked about how aerobic training has 3 defined objectives for exercise. We want it to be maintained at a constant intensity. We want it to promote energy expenditure that's related to a certain skill. And we want required skill and intensities to be variable, such as in sports and intervals. Now, in the slide that you see before you, I have it set up to talk about either the skill and fitness level and the intensity for different endurance types of exercises. The first box that we have here in red is going to be talking about minimal skill and fitness levels for moderate endurance exercises. And these are examples of walking, aquatic exercise, and low intensity cycling. Minimal skill and minimal fitness levels for vigorous endurance exercises have examples such as jogging, running, high impact aerobics or step aerobics, fast-paced dancing, and stationary rowing. For those that are a little bit more advanced, the higher skill levels and higher fitness levels for endurance exercises fall into the categories of skiing, lap swimming, aquatic circuit training, and running. Now, if you want to fall into more athletic realms, then we can talk about recreational sports such as basketball, soccer, and mountain hiking or trail hiking. Now, when it comes to the discussion of minimal skill sets, we need to understand that minimal skill sets are needed for relatively basic movement patterns. For higher skill levels, the movement learning and movement coordination can still be achieved. Physical fitness levels will always improve the more consistent an individual stays with their exercise. So in conclusion, our cardiorespiratory system is a dynamic system that's keeping the cells of the body oxygenated, nutrient-fed, and energy-driven, letting us produce sustainable rhythmic movements. Our program development always needs to have some type of defined goal. It can't just be one of those things where you wake up one day and say, oh, I want to go get my heart and my lungs healthier. You need to have some type of game plan. Exercise options are endless, and it can be as simple like walking or developing a more complex endurance cross-training program. Now, some exercises can be classified as weight-bearing or non-weight bearing. An example of this would be if you have a recumbent stepper that has a seat and the pedals out in front of you, and you're letting your legs move while your feet are not touching the floor. That's considered non-weight bearing. Now, if you get up onto a treadmill, your body, your legs are bearing the full weight of your body as your feet are making contact with that treadmill belt, and that's considered to be weight bearing. When you're starting on any type of exercise program, definitely understand that it's going to require patience on your part for any type of adaptation to occur. Being patient is a very important part because bodies are going to respond to exercise in various time frames and also in different ways. Some people are going to get where their heart and lungs get stronger, but they may not lose weight quite as fast. You have some people who may end up losing a significant amount of weight, but their heart rates or blood pressures may have not been affected quite as much. So patience is key to any type of exercise program. The other thing that patience allows for is it also leads to injury prevention. Now, as I kind of discussed earlier when it came to circuit training, any type of circuit training or interval training is a great way to achieve many aerobic and then also metabolic benefits. Interval training consists of periods of intense work followed by short periods of decreased intensity or even short rest periods. Interval training and circuit training is a great way of constantly changing your variables and exercises to improve your overall physical fitness.